Hi everybody, thank you so much for coming along to our event today, which is all about medicine, exploring medicine, why, how, and next steps. So just to give you a few pointers on how it's going to work today, we are recording this session. So if you miss anything, don't worry about it. Don't feel like you have to take notes and stuff like that, because we'll send out the recording to you afterwards. Also, you are able to type in questions to us through the chat panel. You should see something on your screen where you can type in questions to us. Now, those are only seen by staff members, so that's how you can keep in touch with us throughout today's session. Amazing. So just to do some quick introductions, so before we kick off, my name is Fiona and I work in the widening participation team here at St George's, University of London. I'm not a doctor, but I've worked in St George's for a really long time, and a lot of my job involves speaking to people who are interested in applying to medicine and other healthcare courses about their next steps. So I'm hoping I've got a lot of useful advice and tips to give you, and I'll introduce my colleagues who'll be helping me on this event shortly. So this is what we're going to be covering today. So going to be telling you a bit about St George's, where we are, where we're coming from. Thinking a bit about why medicine, why you might want to do medicine. We're going to be looking at the application process overview. We're then going to be having a break because it's quite a long session, so we're scheduled to end at 5:30. Might finish a little bit before that. We'll see how things go. Then we're going to be looking and thinking a bit about skills required in medicine and healthcare before going on to think about what you can do now to prepare your application. And there'll also be a chance for you to ask questions as well. So we would really encourage you to get in touch with us, interact. We would really like this kind of session to be as two-way as possible. So yeah, do get involved if you can as we go along. So now I'm just going to introduce some colleagues that are on the session as well. So in the background, my colleague Jacob is present, and he's going to be answering some of your questions as we go along. And we also have two of our medical students here as well. Aditi and Sim, do you want to come on and introduce yourselves?
Hi everyone, my name is Aditi and I'm currently a fifth year medical student studying at St George's. I've just finished my fourth year of medicine and I'm now integrating in global health and humanities.
Hi everyone, my name's Sim. I'm a first year medical student at St George's.
Cool, thanks guys. So you're going to be hearing from Aditi and Sim as we go throughout the session. Okay, now before we actually introduce St George's, it'd really be good to hear from you and where you're coming from. So I'm going to launch a poll now. Now, hopefully what you should see on screen is some questions, and you can choose one option. If you can't see the poll when it comes up, if you want to minimize your screen, and hopefully that will allow you to answer the question. So let's see if this works. So this is just asking you a bit about your background. So are you in year 12 at the moment? Are you a graduate intending to apply to medicine? Or are you coming via another route? Or are you maybe a teacher or a parent? It'll just be good to know a little bit about you, our audience, so we can kind of, work with that as we go along and find out a bit about you. Great, I can see a lot of you are responding to that poll. As I say, if you're having issues, if you minimize your window, your screen window, and that might help you to answer that question. Great, I can see coming up to 80% of you have voted. I'll share the information with you all in a minute. Just give you a little bit longer to submit your answers there. Okay, nearly 90% of you have voted, so I might stop it there. Okay, we'll close that poll and now share that with you. So hopefully you can now see most of you, 92% of you are in year 12 at the moment. A couple of you coming via another route and small percentage graduates. Okay, great, useful to know. So hopefully this will be useful for all of you. For those of you who are graduates, it's good to know that at St George's you can apply for our 4-year graduate medicine course and our 5-year course. Entry requirements do differ slightly, so just good to bear that in mind. Amazing, thank you very much for that. Cool. We're gonna now talk a little bit about St George's, just so you know a bit about us and where we come from. So St George's, we are a specialist medicine and healthcare university. We started life as St George's Hospital in Hyde Park Corner over 250 years ago. So you can see a picture on the slide of what used to look like many years ago. In the 80s, St George's moved to Tooting in southwest London. That's where we are at the moment. So on this slide, you can see our current setup. You can see some of our facilities as well. We, as well as kind of having standard university bits and pieces like an SU and sports facilities, we also have pathology room, dissecting room, and other healthcare specialist facilities. So we are unique in that we do share a campus with St George's Hospital. So lots of you might have an insight into the hospital already if you watch 24 Hours in A&E on Channel 4. And I guess if you're studying medicine or healthcare, it's a very kind of particular environment to study in because you're kind of immersed in that environment from the get-go, and we think that's really valuable for our students. So a bit about Tooting in southwest London, which is where St George's is based. So it's about 20-25 minutes on the Northern Line from central London, and Tooting is a really kind of vibrant, buzzy area. If you've ever been there, there's lots of shops and cafes and restaurants. And we do have our own university halls, which you can see a picture of at the bottom, which are about a 50-minute walk away from our campus.
Hi, Fiona. Sorry to interrupt. We're just having some technical issues where the poll's still showing on screen.
Okay.
I'm not sure if there's anything you might be able to do from your end to change that across.
Thanks, Jacob. Let me just see if I can adjust that. Okay, I'm going to share that poll again and then try and hide it and close it. And we'll see if that makes any difference. Okay, just bear with me one. There we go.
Here we can see social life page now.
Great, cool. Okay, I think you missed these slides. So if you recall, so this is what St George's looked like many years ago. This is what St George's looks like today. You can find out more about facilities on our website as well. A few snaps of Tooting here, which apologies you weren't able to see before, and you can see on the slide Horton Halls, which is where our lots of students reside. And again, just some snaps of our students. We have over 100 societies. We've got a really active student union, and lots of opportunities for you to get involved in different extracurricular things if you're a student at St George's. Cool.
Hi, Fiona. Apologies, it's coming again. Just noticed we've got a red kind of pop up at the top there. I'm not sure if we could make it full screen at all.
Okay, I can't see it on my side, I'm afraid. Let me just see. Is it still there?
Yeah, it's still on there. I can share the slides from this side if you'd like.
Is it obscuring the picture?
We'll carry on with it. It's just at the top, so I think we're fine to carry on.
Okay, if it's literally in the sorry, I can't see from my side. Cool, but as long as it's not cutting any text off, that's fine. But we can email you the slides after. But hopefully we'll be talking through everything that you need to know, so it should be fine. Cool. So a bit about alumni at George's. So because we've been, involved in medicine research and practice for so many years, we have lots of famous alumni. So some of them you'll have heard of, people like John Hunter. If you've been to the Hunterian Museum in central London, you'll have seen some of his bits and pieces, his things he's collected, his collection over the years. Edward Jenner as well. So Edward Jenner invented the first vaccine. And you can see on the slide also some more of our more recent graduates as well. We're really proud of the contribution all of our graduates have made to healthcare over the years. Great. So we're going to now think a little bit about why medicine. So presumably you're all here because you're kind of thinking, interested in medicine potentially, and we'd really like to get your perspectives on, why you want to study and practice medicine. So what I'd really like to do is to ask you to contribute via the chat screen, and just to let us know what your kind of motivation is to do medicine. If you just want to type things in, that'd be absolutely great, and then we can share some of them. We're also going to ask our student ambassadors, you know, why they wanted to do medicine as well, and just kind of have a think about different motivations. So if you want to start typing into the chat and let us know why you're interested to do medicine, that would be wonderful. Just give you all a couple of minutes to start typing. Okay, thanks, Abby. So Abby says she's interested in kind of the day-to-day excitement, which, you know, I'm guessing is around, you know, doing different things every day, which is definitely, you know, one thing that's really appealing about medicine. Great. Chidera says she's interested in how medicine can be used to help people. Great. Sam says it's a challenging and rewarding career. Susanna says for her, it's about improving the quality of the life of patients, enjoying science and medicine, wanting to help people, applying knowledge to help people. I think definitely, I guess medicine is one of those careers where it's about the kind of the theory, but also applying that theory and getting to see the results of your work, which is something that'd be really valuable. Great, thank you guys, keep them coming in. Improving people's quality of life, being able to help others, challenging yourself, says George. Interested in working as a team. Yep, working with people. Amazing. You've obviously all given this some thought, which is great. Learn about human anatomy, says Manure. Let's see. Advocating for patients, says Zena. Amazing. That's great. Thanks so much, guys. Ambassadors, did you want to come on and just talk a little bit about why you wanted to study medicine?
Yeah, sure. So I agree with what everyone said so far. It's quite a satisfying profession, I think, and that's definitely when I've been on placement, I've kind of understood that even if you can't cure a patient, you're still a part of their patient journey. So even if someone's, for example, in palliative care, you are helping them through their journey, you're helping their family through their journey, and in that sense, it's very satisfying. Another thing is, I'm really excited that my course is 6 years, like 5 or 6 years. For some people, they might think that that's quite long, but it's quite exciting to be in education for such a long time. Plus, as Fiona mentioned, there are so many other opportunities other than just studying that you can do at uni. So like all the clubs, all the societies, extra research, there are so many different things, and that's what kind of enticed me into medicine.
Yeah, so just to add on to that, so personally, I chose medicine because I'm a patient myself. So being a patient, I know kind of how positive an impact doctors can have, not just on patients, but the families and the wider societies as well. But not only that, as mentioned, kind of bringing together my interests for learning about anatomy, pathology, as well as research, and also bringing that together with the joy of helping people. Personally, that's why kind of I chose medicine.
Amazing, thanks, guys. And yeah, I think, you know, you've obviously all put into, you know, all had a thought, I mean, the audience about kind of, you know, why you want to do medicine in the future. And just to flag, obviously, for those of you in year 12, it's obviously quite an early stage thinking about applying to medicine and so on, but it's such a key thing to think about. And really kind of, I guess, considering your motivation, what that is, and, you know, thinking, well, is that sound? Is that something that medicine can give me? Or, you know, what about another course? And obviously being asked about your motivation is something that you're going to definitely have to talk about if you decide to apply to medicine, your Ucas statement or an interview, and an interview as well. So kind of thinking about that in an early stage is really important. You know, wanting to help people, wanting to study science often come up, and there's nothing wrong with that. It's not the case that you necessarily need to kind of, in terms of making application, think about something that makes you stand out. But I think, you know, you've just got to be, you know, think about your own motivation. Is it genuine? Is it true? And kind of know what is it about medicine that's, you know, you couldn't get from another healthcare course, for example. So why do you want to do medicine and not, you know, physiotherapy or nursing? And that's a question that might come up as well at interview, and it's quite a hard one to answer unless you've really kind of explored, you know, what doctors do and your own motivation around that. Fantastic. Okay. And I suppose leading on from that, it's good to think about the challenges involved in medicine as well, and definitely kind of making that informed decision as to, you know, yes, you want to do medicine, but actually, do you know what the challenges are in studying and practicing medicine, and do you still want to do study medicine while you know those? So it's about making that informed choice. So first of all, again, I'd just really like to ask the audience if you could just type in, you know, what do you think the challenges in studying and practice medicine will be? What might be challenging for you personally, or just difficulties with the job or studying? And then again, we'll ask our ambassadors to contribute after. So if you're happy to share your thoughts with us, that would be amazing. And as I say, we can get our ambassadors' perspective, you know, as medical students, as nearly a medic in Aditi's case, and kind of think about that. Great, I can see some great answers coming through. So having a work-life balance, definitely. These are coming thick and fast, so you're obviously all really aware of I guess the bad bits, the downsides of studying medicine. Making sure you don't take your work home with you so you don't get overwhelmed. Work-life balance, that's definitely coming up. That's really true. Mark says that you can't save everyone. Yep. Long in training hours in hospital placement, says Laura. Yep. So kind of, you know, the long hours of the study kind of reflecting the kind of longer potential hours and working after. Content heavy. Yep. Having to fit in everything, learning everything in the time you have. Being realistic with people, breaking bad news, being patient. Yep, amazing. Mental health and stress. Fantastic. Losing patience. Yep. These are some really great responses, and it's really nice. You know, I think you've all got huge awareness of the difficulties, and yeah, and I think kind of, you know, the stress and emotional side of things is definitely coming up, and that's really important to bear in mind. Sim and Aditi, have you got anything extra that you think that you found in the course that's been difficult?
Yeah, so like mentioned, it is quite content heavy. So you can kind of get, my experience is that you can get into the trap of falling behind if you're not organized. But kind of the uni does a great job of having timetable sessions about how to study effectively and how to organize your time better. There is always support available, but it's just kind of being mindful. It can be a bit content heavy, and just to be organized as best as you can.
I agree with Sim. I remember I was told when I got into medicine that A levels are hard, but when you get into medicine, it'll probably be quite similar to A level content, but there's just so much to remember. That's what makes medicine, you can say, difficult. So it's just how much you need to remember, revise, recall. But as Sim mentioned, honestly, the university, St. George's, gives a lot of support. They give a lot of time for you to actually have your own social time, your own time to unwind. And I also agree with the fact that sometimes the profession can be quite overwhelming. So, for example, we've had placement. You go onto psychiatric wards and you see things like cardiac arrest where patients don't survive. And for you to see that in your third and fourth year of medicine, it can be quite overwhelming. But again, the university is there to support you. A lot of doctors are there to support you. So you do you are able to deal with it as the time goes on.
Cool, thanks, guys. And this actually, you know, a lot of the audience have kind of talked about, you know, this kind of stuff. So around kind of, I think around like mental health management, really. Have you got any tips? You're in your you're intercalating after your fourth year, so you're fairly you know, well on in the course. Have you got any tips for people about kind of managing that side of things?
100%, I would say don't give up on your hobbies or things you like to do. Obviously, medicine is important and you need to put a lot of effort into learning and being with patients. But for example, with me, straight after this, I'm going to be going to do some dancing. for a show at university. So make sure that you have time for yourself. Read a book, do your dancing, do your singing, play your instruments, do your sports, whatever. Universities give you Wednesday afternoon off so that you can do your sports. So yeah, and of course there are counselling services at uni. You have your friends, you have your personal tutor who you do meet often in the year. So there is a lot of support for you to look after your mental well-being, as well as, of course, your physical health as well.
Fab, thanks, Stacey. I think, yeah, you've come up with some really valid points. I think it is just about, as I say, like just having a realistic idea of what things are going to be like, and that, you know, things are going to be challenging, hard. Aveline said, you know, you're working, you know, long hours and lengths of study compared to friends who are going to be working less and earning more. But being prepared for that and knowing it's something that's going to happen and kind of being prepared to accept it, I think, is key. And as I say, this is even something, you know, it's about thinking about your suitability for the profession as well. So in terms of thinking about, you know, emotional resilience and managing working with patients, it's about thinking, well, do I think I can do that type of thing? Am I the type of person that will be able to kind of keep that work-life balance? And it could be something that you're asked about at interview as well. So, you know, it's about thinking about strategies, you know, how would you cope in these ways, and having a really good sense of yourself and how you can look after yourself and what works for you to kind of chill out and calm down and to be able to deal with stress is really important. And as I say, thinking about that for interviews as well is important as well. Amazing. Thank you so much for contributing, everyone. I'm also impressed when with their audiences and how insightful you already are about these type of things. So thanks so much for contributing. Okay, so now we've thought about those things, we're going to move on to thinking a bit about the application process for medicine, which is kind of big, long, complicated. I'm going to be talking about lots of different bits here, but some of them, you know, you don't really need to think, especially if you're in your age 12, you don't really need to be thinking about quite yet. And if you have a look at this slide, you can see this kind of gives you the pathway, I suppose, the things you need to think about if you're applying for medicine through Ucas and the way that things go. So there's a lot of different things to take in here. It looks quite complicated, as I say, but the most important thing really is about breaking all this down into chunks and thinking, all right, when do I need to do this and when do I need to think about this, and doing that research beforehand and making sure you have dates and deadlines in your diary is really, really key. So I'm just going to talk briefly about the things that you need to think about. So at the moment, if you're in year 12, which most of you are, you'll be thinking about applying for 2023 entry for medicine. So therefore, you'd need to apply by 15th of October this year. Seems a long way off. One thing to think about, we're going to talk about that later on, is kind of getting work experience and alternatives. That's something that you can be thinking about now until interviews. I think pretty much all medical schools interview, so you have to kind of plan for that to take place before you'd be made an offer. Admissions tests, lots of universities ask you to take admissions tests, and usually you take them in the year of application. After that, Ucas Deadline, which is normally absolute. As I say, interviews normally take place between November and March. It depends on the university as to at what point they run their interviews. And then offers come after that, and they're often based on interview and conditional on grades, for example, if you're doing A-levels. In terms of the Ucas form, obviously you've got to input, you know, the university will look at entry criteria, so are you going to meet the academic grades? There's your personal statement and academic reference. Okay, so like I say, a lot to kind of think about if you look at it all in one, but breaking it down into chunks definitely makes it more manageable. Okay, so first off, looking at academic entry requirements. So these are different, obviously, at different universities. It's really the first thing that you should be thinking about in terms of thinking, well, where am I going to apply? I've included St George's Medicine A100. So that's our standard school leaver course, although graduates can apply for this course as well. So I've included the entry requirements here. So we're looking for 3 A's at A-level, including chemistry and biology, and 5 GCSEs graded B or 6 or above, including English language, maths and science. So chemistry and biology are usually the most important subjects. GCSEs can be important, but different units will be looking for different grades. And it's really important to do all that research beforehand to make sure that you're only applying for courses where you're going to meet the academic requirements, and to be realistic with yourself about what you think you can achieve. So when you put in your Ucas application, only 4 of those choices, you have 5 choices, but only 4 of them can be for medicine. So you really need to make those choices, you know, with as much knowledge as you can. lots of different universities and medical schools will have contextual offers, and what that means is that people who meet certain criteria might be given a lower offer. Okay, often this is kind of framed as a widening participation initiative, so it might apply to different groups of people who maybe live in certain postcodes or have certain circumstances that may have affected their ability to achieve academically. So it's always worth checking if you think that you fall into one of these groups. So maybe you live in a particular postcode where not many people go to university, or in quite a deprived area, or if you are eligible for free school meals, for instance, or you are in care or a care leaver. Just do check out different contextual offers at different universities. And it is a bit confusing because they're different in different universities, but it's always worth checking to see if you are eligible, because you could get a lower grade offer. And again, these are different universities, but it's good to bear in mind. So just to highlight that lots of universities will now have their 2023 entry requirements up. Always do check university websites for the year that you're applying to, because entry requirements can change from year to year. So for instance, at St George's, our 2023 medicine and other course entry requirements on our website. But just wanted to flag, seeing as I'm talking about contextual admissions and offers, that the St George's contextual offer is changing for 2023. It's not up on our website yet, but it will be in a couple of weeks, hopefully. So just do check back on that in a couple of weeks if you think you might be eligible for that. So I wanted to run another quick poll now, just to get a sense of how much you think you know about admissions tests for medicine before I go on to talk about them. So maybe these words BMAT, UCAT will mean something to you, maybe not, we will see. So I'm going to run another poll now, so hopefully you'll be able to respond. So how much do you know about the admissions tests for medicine? Have you not heard of them? Have you heard of them but you don't know much about them? Have you done loads of research already? Have you gone to the test website so you know a little bit about them? Great, okay. If you could just answer that poll, and then I will share the results in a couple of seconds. It's just really useful to know kind of where you, the audience, are on this, kind of how much research you've done and so on. Cool. See, nearly 70% of you have filled in that poll, so I'll just give you a little bit longer. Might just wait till we get up to 80%. Cool, most of you have filled that in, thank you. 83%, 84%, 85%. I will close that poll now because most of you have replied. Thank you so much. Let's share those results. So most of you have heard of them, but you don't know much about them, and I think that's absolutely fine. I think there's, don't feel too worried that if you haven't done much research already, having heard of them at this stage, certainly if you're in year 12, you've got lots of time to kind of, find out a bit more. 32% of you have gone to the test websites, and 11% of you have done loads of research already. That's great. So if you're in that 3% that haven't heard of them, maybe just do a bit of preliminary research now. Lots of universities will ask for example, the UCAT, so it's good to kind of start, getting a sense of things now. But having said that, sometimes it's good not to do too much research before you really need to, otherwise it's easy to get overwhelmed. Great. I think, that all sounds good, and yeah, you all look to be in a good place. Amazing. Now, hopefully, yeah, fab, you should be able to see the screen again now. I'm just going to talk a little bit, give a brief overview of admissions tests. So most universities would ask for the UCAT. I think over 30 medical schools do, and St George's does. Essentially, this is a test which is about your aptitude. So it's like looking at things like logic, your decision making, and things like that. It's not about knowledge. So there's no specific curriculum or science content in there, but it's about, like I say, your very skills and so on. You do need to take that test in the year of application cycle. So if you're applying for 2023 entry and you're applying in 2022, you would take it this year. It normally takes place over the summer, so like July till October or September, I think. So yeah, so you definitely got time if you're thinking about the UCAT. Because it's a funny kind of test, it's not something where you can revise for, but you can prepare. And with a lot of these kind of tests, just getting a sense of how the tests work, you know, what kind of questions you might be asked, and actually doing practice questions just to get a sense of, you know, how many questions you can fill in the amount of time is useful. I think for the UCAT, you don't always have time to answer all the questions, so actually part of doing well in this test is about making decisions about which questions to spend time on and which ones to not spend time on, if that makes sense. I'm pretty sure you can get an app where you can just do practice questions, and I think that's really a great thing to do to just get yourself familiarized with the test and how it's going to work. BMAT, less universities ask for, but some do. So again, it's about making sure that you're aware when you're thinking about unis, you know, what do they ask you to take and when do you have to take the test. So I think BMAT has a few sittings, and different unis have different kind of sittings. So they say you have to take the one in September or whenever it is. So again, you do need to check that before. The BMAT has 3 sections, and one of them is science. So it is kind of about that, you know, kind of academic content. But again, you can get practice questions and preparation material online. Both of these tests have test fees, but they both have bursaries if you meet certain criteria. So again, if you're from, you know, a group that maybe lives in a postcode where not many people go to uni, or if you're eligible for free school meals or something like that, do have a look, because you might be eligible to get a reimbursement of those test fees. Cool. Yeah, so again, just good to maybe start thinking about these now and just having a basic awareness of these, I think. Amazing. Next slide. Personal statement. So the personal statement is part of your Ucas application, so you have to write a personal statement, which is a certain amount of words. Each university you apply to will get it, and it's really about, you know, you telling the university a bit more about yourself, about, you know, your motivation, your passion for studying the courses that you want to apply to, and basically, you know, telling universities about why you're the right candidate. Now, you don't need to think about these for a little while yet, but it's just good to have an awareness that, I guess, that it's something that you need to do later on, but also to be aware that not all universities will use personal statements in the same way. Okay, and actually that's the same for admissions tests as well. So annoyingly, although lots of unis might ask you to take an admissions test, like say the UCAT, they won't all use it in the same way. Okay, so some universities might have particular scores they ask you to get, and other unis will say, we don't have a particular score, but we will look at it holistically along with everything else. So yeah, something to think about. And again, you might want to be strategic and take the UCAT, for example, and if you don't do well in it, then think, well, I'm going to apply to universities that doesn't have a particular score or doesn't use it. Okay. So confusingly, you know, it's again about doing lots of research just to figure out what the best path for you is. Yeah, so personal statement is something that you have to do. Even if a university doesn't look at it, they will still get your personal statement. And yeah, I wouldn't worry about it and just yet, I don't think. One thing that universities do traditionally ask for and have asked for in the past for medicine is about work experience. So, you know, having relevant work experience for medicine. So lots of universities kind of previously had this as one of their entry requirements, and that's kind of changed a bit over the pandemic. But I am going to talk a little bit about, I guess, getting insight into medicine, because that's really one of the points of that work experience. It's about gaining insight into what it's like working with people in need of care. And that's one of the reasons universities and medical schools asked for people to get that work experiences, so they can have that insight. They have a realistic idea of what it's like, and they can also, you know, develop those skills that are really important for medics to use as well. And that's something that people choose to write about in the personal statement, is their experience and their insight into medicine, for example. So like I said, obviously the pandemic has had a massive impact on the work experience that people can get. So in previous years, I know, you know, lots of applicants for medicine really wanted to get things like shadowing experience, shadowing a doctor, or, you know, trying to get work experience, working or volunteering in an old people's home, or, you know, with other people, groups of people in need of care. But we understand that, you know, it's been really hard to get that, particularly clinical based work experience for the last few years. And lots of universities will have relaxed their work experience requirements as a result. So on the slide here, you can see the statement that's on our website for medicine applicants for 2023 entry. So, you know, our statement says that we understand the challenges that people have had trying to get work experience. So we've chosen to relax our work experience requirements. Okay, but despite these relaxed requirements, we still require our applicants to have an understanding of the realities of working as a healthcare professional and to show they have the necessary skills and attributes for their chosen career. Okay, I'm going to come on to talk about skills and attributes in a bit, but just wanted to flag that, you know, it's really possible to have an understanding of what it's like and to gain insight into the realities of working as a healthcare professional without doing kind of face-to-face and clinical work experience. So some things that we recommend are, you know, looking into things like free talks, courses, podcasts. We're going to send this to you after, so don't feel like you have to start writing these down. And just reading books. You've probably all heard of Adam Kay's book, which actually I think has just started as a TV adaptation. It's about his diaries from when he was a junior doctor. And there's lots of podcasts where you can find out a bit more and hear about people's experiences. There's online courses as well. So there's Observe GP, which is about GPs. Brighton and Sussex Medical School also have an online work experience platform as well. Lots of YouTubers can give you information and insight about what it's like studying and working in medicine as well. So it's about kind of doing that research and gaining that insight yourself. Yeah, lots and lots of tips there. Something that we're also going to cover in our webinar series in next month is work experience. So we're doing a webinar all about work experience for healthcare courses, which includes medicine, on Wednesday, 30th of March. So we'd really encourage you to come along for that, find out a bit more about work experience and, you know, reflecting on your experiences. And it's around kind of, you know, thinking about that in terms of interview as well. So do come along to that if you're interested. So I've kind of alluded to this already, but applications and admissions for medicine courses are very different. As I've said, different unis will look at different things when they're kind of assessing people's applications. So some universities will look holistically at everything, your predicted grades, your personal statement, maybe an interview as well, maybe admissions scores, admissions test scores, and look at all that when they're thinking, you know, if they want to offer you an interview or a place. At George's, the way it works is that if you meet the academic criteria that we specify on our website, if you meet that minimum criteria and you meet our UCAT or GAMSAT for graduate entry medicine score, then you're offered an interview. Okay, so that's purely what we look at George's. We don't look at the personal statement. Okay, and if, for example, so our academic criteria for A levels is 3 A's. If you get A stars, then you know you're not kind of given any preferential treatment. It's if you meet that baseline, then you've kind of passed that hurdle, if that makes sense. That's where we do it at George's, but different medical schools will do things in different ways. So it's really important to find out beforehand during the application process how you're going to be assessed by different universities and what exactly they're going to be looking at. And that will just help you make a more informed choice about where you can stand the best chance of being considered, basically. Cool. Now, this is a really long way off, so I'm really not going to talk about this very much, but interviews, as I mentioned, most medical schools do interview. Interviews come in different formats as well. So at George's, we do the multi-mini interview, and you can see on the slide what it looks like when we do these face-to-face, which we hope we will be doing for the 2023 cohort, for 2023 applications. So essentially, you have a number of small stations. It's a series of like 5-minute interviews at George's. Okay, you have different interviewers, and you might be given different activities or questions. And lots of medical schools increasingly are using MMIs, multi-mini interviews, to assess. Some universities also use kind of group interviews as well, kind of as part of that, and you can get different numbers of stations and stations of different lengths depending at the university as well. So some might be 5 minutes, some might be 10. And panel interviews, traditional panel interview, you're sat opposite a few people talking back and forth. Remote interviews have increasingly been used over the past couple of years for obvious reasons due to COVID. And I guess these could continue to feature potentially going forward, so it's just bearing that in mind. Remote interviews at George's, for example, we still continue to do multi-mini interviews, but we actually got candidates to record their answers rather than having a live interview. So that's quite different, you know, it's quite a different kind of experience. So just good to know at this point that there's lots of different types of interview, I guess. Cool. That is a whistle-stop tour through admissions and applications. And as I say, it's a lot to take in, but I think it's all about looking at it separately, piecemeal, and thinking about, well, what's my priority at this stage? Okay, so we're going to take a short break because I'm sure you're kind of, need a bit of a break from your screen now. We'll come back at 10 to 5 for the second part of our session. Please don't leave the webinar, just stay there and yeah, just come back at 10 minutes and we'll see you shortly. Okay, bye for now. Hello, everybody. Hopefully you've come back from your break now and you're feeling a bit better. Thank you for sticking with us. We're going to move on now to talk. Hopefully, I'm going to be doing a bit less talking in this half of the session, but we're going to be moving on to talk a bit about different skills for medicine. So we talked about these, we kind of alluded to these a little bit earlier. And certainly through work experience, getting work experience if you can, even if it's not in a clinical area, can be a way that you can showcase skills required. And also earlier when we were talking about the challenges of working in medicine, so thinking about what those are and what the kind of skills are that you're going to need to kind of overcome those challenges is something that we're going to be thinking about now. So I'd really like to get, again, your perspective on what you think the valuable skills required in medicine and healthcare are. So what skills do you think you need to succeed first in kind of studying medicine, but also working as a doctor later on? So as we did before, we'll get you guys to kind of contribute. We'll read out some of your ideas, and then we'll get our ambassadors who are studying medicine to contribute there. So do please start putting anything in the chat. There's not really going to be any kind of wrong answers at all. So do feel free to kind of contribute any ideas that you have, and we'll go through them. Great. So fabulous. Thank you, guys. We've got kind of determination coming through, definitely resilience, honesty, good social skills. Yeah, if you're a doctor where you're working with lots of different types of people. Empathy, communications coming out really strongly. That's great. Professionalism, says Amira. And it's really important to bear in mind, actually, with professionalism, that's something that you're kind of expected to demonstrate that when you're a student on the course. Actually, it's the same for any healthcare course, really, because you're doing placements, and on those courses, you're going to be interacting with other staff and vulnerable patients. So you need to really have that kind of professional attitude on your course from the get-go. Being a good listener, yeah, listening is obviously a key part of communication, but sometimes gets overlooked, I guess. Leadership, yeah, and teamwork as well. That's what Susanna says. Compassion, definitely kind of linked with empathy there if you're thinking about working with patients and understanding where they're coming from and why they might be making certain choices. Organization, yep, problem solving. People skills, honesty, yep. So being honest even when it's not maybe the easiest thing to do. Being calm under pressure, yep, can be more important, I guess, in certain specialisms than others. Empathy, time management, having ambition, soft skills, amazing. Loads and loads of good ideas coming in. Aditi and Sim, have you guys got any that you found really important in your kind of journeys as medical students that you want to add?
Sim, do you want to go first?
Yeah, sure. So you guys have given some really good skills. So just to echo that, I think communication's really important. So we start placements quite early on the course. So it's really important to have that key skill. But we also get to practice it a lot as well during our sessions. So we have communication sessions. We also, so we get to work with each other. And then we also, sometimes the uni brings in some actors as well, which is really useful to kind of build that skill as we go on. Also, I'd say teamwork as well is really important, not just for the future career where we'll be working in a really huge diverse team, but also kind of in our small tutorial sessions where we can kind of feed off each other. So I would say that teamwork is a really important skill as well.
Yes, I agree with everything Sim's just said. Definitely time management. You need to be able to juggle your lectures, your placement time, especially as you become further on in the course. So third year, fourth year, fifth year, you're expected to be there from about 9 till 5. You might even be doing night shifts. So you really need to be able to juggle your time, as well as, of course, your extracurricular and your revision time as well. Another thing I think was mentioned was problem solving. Obviously, if patients come in with a set of symptoms, you won't have just one condition that will have those symptoms. Many conditions can kind of mimic other conditions. So you need to kind of be a detective, be able to analyze what's going on, be able to understand the information and all the data, and then solve the problem essentially.
Fab. Thanks, Aditi and Sim. Yeah, we've got some more of these to show. So you guys have come up with some great, oops, keep just going ahead on the slides. I've come up with some great ideas. If you have a look at this GMC document, it's about the duties of a doctor, which seems slightly irrelevant, but actually it goes through the duties of a doctor and kind of the way a doctor's supposed to behave. So this might be a good starter for you. Also thinking about kind of key competencies, skills, and things for doctors and students. These are things that St. George's is looking for in particular from our medical students. Okay, so lots of them are ones that you've brought up already. So things like empathy, being able to kind of see where a patient is coming from. Communication skills, lots of you've mentioned. That can take in leadership, good listening as well. Organisation problem solving, we've already talked about. Being able to learn effectively, that's something that I think is really key, as Aditi has kind of referenced, for medical school in particular. So, you've got so much content to get through. Being organised is important, but I think, knowing the best way that you learn and making sure you figure that out early on so that you can work out the best way for you to absorb all that knowledge and retain it is really important. Insight and integrity, obviously I'm sure you're all aware of, we've talked a bit about professionalism, but also like the Hippocratic Oath and codes of conduct that doctors need to have. Certainly that's something that you'll need to think about later on for interviews and kind of having an idea of what those things are. And again, we've talked about resilience already and teamwork, being able to take the initiative, being able to make decisions, again, really, really important as well. So obviously, like we've said, this isn't all the kind of key skills and qualities that a doctor might need, but there's some of them. And like I say, this GMC document can help you kind of think about that going forward. And I think the reason it's important to start thinking about, what the key skills for a doctor are is it's about later on down the line when you're all getting to interview stage, if you decide to apply for medicine, it's about thinking how you can showcase, that you're a good candidate, because essentially what medical schools are going to be looking for is people who've got the academic grades and so on. But with interviews, it's often all about these kind of soft skills. So it's about looking for candidates who are good at communicating, who've got the potential to become good doctors and can show us that they have some of these key skills. So thinking about how you can demonstrate to universities that you have some of these key skills is cool. And again, we'll be thinking about that in further detail in our work experience webinar. Another plug on the 30th of March. So like I say, do come along if you want to kind of explore these things a bit more. Okay, so I am going to stop talking for a bit now, which I'm sure you'll be pleased to hear, and we're going to hear a bit more from our medical students, and they're going to be talking to you a bit more about, their journeys to medical school, how they got there, and also a bit about, what universities and courses to apply to. So what did they take into account? Maybe think about some things that they think you should take into account, and they're also going to talk a bit about, give you their tips on preparing a medicine application. So at this point, I'm going to hand over to Aditi and Sim.
Okay, so I'll go first. In terms of my journey to medical school, I've just come straight out of school. So obviously school and then sixth form, and then I came to St. George's. So I guess mine was just that route. Yeah, Sim?
Yeah, so mine was a bit longer. So I did a degree and then I did a master's, worked for a couple of years, and so then came to St. George's.
I think definitely the time in year 12 and year 13 is quite difficult because you're kind of struggling to know what you want to do. There's so much information out there with regards to how to apply to, for example, medicine. But I think hopefully this session has been very, it's kind of narrowed everything down. I think if I had this session before, or if I had attended it about 6 years ago, then I probably would have had a better understanding than I probably did in year 12. Okay, so choosing what universities and courses to apply to. I would say definitely look at the websites of each university. I think a lot of information is given on the websites in quite a concise manner. So it's good to look at that. Make sure to look at the course structure as well, because a lot of universities have different course structures. So for example, George's, I really liked it because the first 2 years are quite theory based. You do get a bit of placement time and you do get a lot of practical elements in the first 2 years. Then third year onwards, you're on placement. So all the skills that you've learned in your first 2 years, all the knowledge that you've gained, you can then do it on actual patients, which I really liked the structure of. Other universities might have 3 or 4 years of theory and then 1 or 2 years of placement, which might be nice for some people, but I think I learned better practically, which is what St. George's has given me. And I think Fiona mentioned, make sure to look at the requirements of each university and be realistic about what you can achieve, because I know a lot of people kind of go for a uni because it's a big uni, it's quite a renowned uni, but might not be able to achieve what the university is requiring of them. So I think make sure to be realistic and know what you can do for yourself.
Yeah, so just kind of echoing on from what Aditi said, I think it's definitely important to look at kind of the websites and just have a look at kind of how the course will be structured. And also kind of, so for example, sometimes the course websites will say the particular modules as well. I know, for example, in our curriculum for the first year, there's a new module about genomics and kind of the future of medicine. So I know that other universities haven't implemented that as of yet. So that was quite interesting for me, and that was kind of one of the reasons why I wanted to come to St. George's as well. Another thing I would say is be mindful of the location of the uni as well, because it is 5 years, so it's a bit of a commitment. So make sure you'll be kind of comfortable in the environment if you'd like to commute or if you'd like to stay out. So that's something I'd say to be mindful of as well. And in terms of kind of any tips to prepare an application, what I would say is be organized. So just kind of have in mind those deadlines. So the Ucas deadline, the Ucat deadline. What I found helpful was in terms of kind of preparing for interviews, just kind of having a document of all your experiences. So you can kind of practice that. And when the time comes to prepare for interviews, you can kind of look at that document and just recall kind of what your experience was, what you've done, and kind of what you learned. And those steps will be really useful for you. And it's kind of what we do in the course as well in terms of reflection after placements as well. So it will kind of get you in that mindset.
Yeah, I totally agree with what Sim has said. So we've mentioned obviously doing your personal statement, focusing on that. Make sure you know your personal statement inside out, in case universities do question you on certain things you've written. Also, I think another thing is, whilst you're preparing for your UCAT, BMAT, your personal statement, don't neglect your A-levels, because obviously that's still another barrier, still another hurdle for you to have to get past in order to get your seat in med school. And another thing is, if for whatever reason you don't get an offer from a university and you find that out quite early on, I know it can be distressing, but don't let that get to you, because if you do let that get to you, then maybe you're affecting the chances of your other university acceptingness coming through. So make sure just to try not to be discouraged, focus on your next university, focus on your next interview, and hopefully you'll be able to smash that and then eventually get your seat. And just another thing, sorry, you can also email the universities if you do have any questions. Don't hesitate. I think some people I've come across, they think that, oh, if I keep emailing the unis, they won't accept me later, or they'll think that I'm being annoying. Don't think that. They have a team that's ready to answer your questions and obviously look after you. So if you have any questions that you think the website hasn't answered, or you haven't gotten an answer from an open day, then make sure to just email in.
Thank you, guys. Is there anything? Well, I'll wait and see if there's any questions for you, and then I might quiz you both. But yeah, thanks so much for your contributions, guys. I think I had put some tips myself, which I think some of these have already been covered a bit by our students. So just thinking a bit about applications and admissions and top tips. Let me just make sure I'm sharing the right screen. There we go. as we've mentioned kind of throughout, doing your research on entry requirements, so as Didi said, being realistic and strategic about where you're applying and where you're going to apply. And again, it's something that you don't need to think about right now, but it's something that you'll, I guess, narrow down as you go along. So, you know, if you do decide to do the UCAT, you know, once you have the results, that might narrow your choices down a bit more, or with BMAT, if you find out a bit more about it and when the dates are coming in, exploring universities as well. So in terms of choosing universities and courses, our students are kind of giving you some valuable tips that bound looking at things like course structure. And we do appreciate that at the moment it's still, you know, not that easy to come and, you know, visit universities. So some universities are starting to have open days. At the moment at St. George's, we don't know what we're doing in terms of having on-site events. Obviously things are, you know, we've got quite a small campus, so we have different things to think about. So I think definitely universities will still be doing lots of virtual events this year. And it can sometimes feel like it's a bit harder to make decisions if you're not getting to go and visit campuses and things. But I would encourage you all to you know, attend on-site events if you can, but also talking to current students is really key. So getting an insight into, you know, what the current students think about the university, what's their experience, what are the good bits and the bad bits of studying, because, you know, prospectuses and uni websites will show you all the good bits. They're not going to tell you the bad bits, but current students will. So they're really a great source of insight if you're kind of thinking later on about where you might want to go. And as I've mentioned earlier, thinking about those key skills and qualities of medicine and thinking, you know, how can I prove to universities that you have them? And I think Sim mentioned before, kind of, you know, making notes and kind of key things and examples for yourself can be really good. And just getting that together as you go along can be helpful and a useful tool for you when it comes to that point where you're doing interviews and applications later on. Amazing. Now we are have time for some questions. So I'm going to have a quick look and see what we have. Amazing. Ambassadors, do you want to come on screen? And we'll just see if anyone has any questions. I would say if you've got any particular questions for Sim or Aditi as well, based on what you've heard about them and their experiences, do please pop them in the chat, and you know, they can talk to you a bit about, you know, their experiences too. Okay, so Ayan is asking, do you have any book recommendations for students wanting to study medicine? So Sim and Aditi, I don't know if either of you have got any ideas or any kind of useful resources that you find useful. Aditi, it might be a while back for you, but yeah.
So in terms of kind of books, I think it's important to read about kind of what a junior doctor kind of how their life is. So for example, This Is Going to Hurt by Adam Kay. There's also Do No Harm, which is about a consultant. They're quite good to kind of understand the limitations of medicine as well. So I think we mentioned at the beginning about not being able to save everyone and stuff like that. I think the books are that they're quite good with the experiences and the way in which they present them.
Yeah, I totally agree with Sim. I don't think I have anything to add. Do No Harm was a very good book. I read that before my interviews. And recently, actually, Henry Marsh had come to be a part of a talk for Neuroscience Society, I think. So it's a very good way if you kind of read books and, you know, understand, get an insight into medicine. And our university is very good with giving opportunities to people to meet certain consultants, to meet doctors and meet authors. So yeah, definitely if you can talk about them in interviews, it should heighten your application.
Great, thank you. Let's see. Year 12 student saying, you know, if I'm a year 12 student, what should I be doing right now, getting ready to apply for medicine later on? What do you guys think?
One thing I would recommend is to keep watching the news. It might sound silly, but there's a lot you can get out of the news, especially with the cohort you're all in now, if you are in year 12 or however you're applying. The pandemic is it's a hot topic right now. There's so much going on. So if you are up to date from year 12 all the way up until year 13, that year span, if you're up to date with what's going on in terms of for NHS, for our healthcare system, that can be very beneficial for you. Of course, I know work experience is probably very difficult right now because of the pandemic, but if you are able to, as Fiona's mentioned, do some online work experiences, maybe do some volunteering, that might be helpful as well.
Yeah, so I completely agree with what Aditi said. I think following on from that, if there's a particular topic that you're really interested in, I think reading around that topic is useful as well, and just seeing kind of have there been any latest developments. Another thing, as I mentioned, is just kind of any experiences you've had, even though you might think they're quite small, just putting them in a document and just kind of trying to relate it to some of the key competencies. So, for example, if you're in a football team, you can kind of relate that to teamwork. Just having that in a document, just so when the time comes, you can really go back to it.
Thanks both. And I think it's difficult because at this point in year 12, it's fairly early on. So I think, to be honest, I wouldn't get so worried about what do I need to be doing right now. I think, coming to events like this is great, kind of doing a bit of research, doing things as you go along, but I wouldn't say there's anything that you need to be working on right now. You still have time, and it's important to maybe break up the year. So definitely, I think I don't know, what do you guys reckon for UCAT? If you think about UCAT and revising for that, it's another question someone's asked. I would probably say not right now, but nearer the time. What do you guys think?
Yes, I would agree. I think nearer the time, so I definitely focus on your exams and school stuff, and then kind of once that's out of the way, because you can book the UCAT anytime between a particular period. So I think it's just before the Ucas deadline. So, so for example, if you have a few weeks, that you're not going to have to focus on your schoolwork, you can really start to plan, make a schedule, and then just practice questions and kind of increase the workload until the actual day. So on the day of the test, you'll kind of be at your peak performance.
Yeah, I agree. And I think it depends on how you are as well when it comes to revision. I think for me personally, the last 2 or 3 weeks before an exam, I really sit down and I just get on with my work. So I think UCAT, in my time it was UKCAT. So for UCAT, I think it's around summertime, if I'm not mistaken. I remember I was on holiday like 3 weeks before. I took my UCAT stuff. In the evening, I would just try and quickly do some work. And in the day, I'd just chill. But then when I came back, I literally put myself in my room and just went through all the resources as much as I could. So yeah, I don't think you need to do like a over time period kind of long-term revision for UCAT.
Yeah, I think at this point, I think it's about having an idea of dates, so getting those dates for UCAT when it opens, and BMAT dates in as well, and just knowing, so that if you're like, oh, I know I'm not going to be away then I'll kind of need to make a plan. So now it's just getting a basic idea, getting the dates in the diary, and yeah, I think other ambassadors I've spoken to have said that they think it's, for them as well, like Edith said, it does depend on the person, but it can be quite useful to kind of focus on it near the time, because otherwise it just kind of goes out your head and stuff like that. So yeah. Someone has asked, do you need to have steady hands to become a doctor? I would say no, not unless you're kind of certain that you want to be a surgeon. I don't know if you guys kind of think similar.
Yeah, I totally agree with what Fiona's just said. I don't think I've ever thought about having steady hands before coming into medicine. But so for example, with things like taking bloods, doing cannulas, for the first 2 years at George's, you're taught the techniques and the skills to do that. So because we practice so much, if for those skills you need a steady hand, it just comes naturally. And then when you go on placement, it's super easy for you to do. So I'm sure you'll be fine if you don't have steady hands, unless of course you want to be a surgeon. But then you still have 5 years during med school to kind of sort your steadiness out, I guess.
Yeah, cool. We've got some nice questions about, I guess, your perspectives as students. So, why did you guys specifically choose medicine over another science-based course or healthcare course?
Yeah, so I studied another healthcare course before, but I found that in medicine there's a greater link to research as well. So whereas in other healthcare courses, you can't really get involved in research as much, but as in medicine, there's that automatic kind of research component which is built into the degree. So I think both the research aspect and clinical aspect, in particular in medicine, it really kind of meshes well together. And that's one of the main reasons why I decided to go back to uni to study medicine.
How about you, Aditi? Or were you just like, no, it's only medicine and that's it?
No, I think for me, I know that doctors have quite a big role in kind of being the leaders of a multidisciplinary team, I guess. And of course, everyone has a very big input. All healthcare professionals have a very big input in patient care. But I kind of like the fact that doctors kind of make the decisions. Things kind of come on them if things don't go to plan, if things do go to plan. And I think I just kind of liked the idea of that. And of course, doing shadowing, I didn't just shadow doctors. I shadowed nurses. I shadowed pharmacists, physiotherapists. So I kind of got an insight into everything. But I think I went towards medicine because I just loved how involved they were in patient care holistically, not just in one aspect of patient's health.
Fab. Thank you. Now, the next couple of questions are around, I think, about your experience at med school. And I think you both have quite different perspectives as a first year student, Aditi, as someone towards the end of the course. Do you find the amount of work kind of restricted your social life and ability to make friends, particularly at the beginning of the course? So if we go to maybe Sim first, because you're near the beginning of the course, I suppose.
Yeah, so as I mentioned, there is a lot of content, but it's definitely manageable, and you can still kind of people say that you won't have any time, but you definitely do have like time. And I think the uni is kind of really strict on finding time, so there's a lot of societies as well. So you can continue on with your hobbies, but there's also kind of new hobbies and stuff that you can find as well. So for example, like I've joined a society at uni which is involved in like teaching, and I didn't think I'd be interested in that aspect, but it's kind of led me to make kind of new friends on the course and stuff like that. So I'd say there definitely is a lot of content, but it's definitely manageable, and kind of every medical student's in the kind of the same position at the start as well. So it's really easy to get along and make new friends as well.
And Sim, your kind of experience, I mean, has been a bit, impacted by the pandemic as well. So how have you found that? I mean, I guess you could compare it with your previous university when you started there. How has it been kind of in the pandemic and, making friends and that side of things, the social side of things?
Yeah, so unfortunately, some of our lectures and stuff was moved online because of the pandemic. But kind of we still have even though it's online, we still have kind of small tutorial sessions. So we're still kind of able to talk in those tutorial sessions as well. And it's been quite good just kind of getting to know people, because being online as well, there's also a lot of other opportunities as well. Sometimes you might not be able to travel to society events and stuff. Having them online has meant like you can join them from your home as well. But again, everybody's been in kind of the same position. So we've all been able to kind of bond over the fact that we haven't really had much on-site teaching for the start. But it is kind of, in my experiences, is we're getting on-site more as well now. So that's good.
Great, thanks. And now we have a question I think it might be good for Aditi to respond to. So where do you have clinical placements and what do you do on them? And again, I guess that might differ as you go along the course, mightn't it?
So in terms of clinical placements, for us, mainly it starts third year. And then fourth year, so third year you have half the year doing lectures and then half the year doing placement. Fourth year, fifth year is full-time placement. So in terms of where you're placed, a lot of the hospitals are, for example, St Heliers, St George's, Epsom, so all kind of this side of like the south kind of side of London. But you do also have some faraway placements. So for example, in Frimley, in Chertsey, and St George's are very kind. They give you accommodation for those placements that are far away. So you do have a place to stay. You're there for about 5-6 weeks, and then you rotate again to another location, to another hospital for another 5-6 weeks. and each placement you have a different specialty. So you're kind of focusing, let's say, pediatrics, cardiology, hematology. 5 weeks in one area, you get to learn a lot in that time. And of course, as medical students, it's kind of up to you how you use that time. So it's best to stay on placement, really get involved, be a part of the team. They should basically treat you as staff because you're so helpful for them, hopefully.
Thanks, Aditi. And I guess that's how placements work at George's. Obviously, all medical schools have placements, and they'll be in different areas. So you get to do different things. But as Aditi mentioned earlier, it's kind of different depending on the university. So at George's, I think you get GP visits early on, I think, don't you, in the course? But yeah, the bulk of the placements are later on. Okay, we've got time for one more question, I think. Again, this is thinking quite far ahead. How to revise best for interviews? What are your tips?
I think it's just kind of practicing, and if you can find kind of someone to practice with, it's even better. So you can use a family member. If you can find kind of a friend or someone who's going through the same experience as well, that would be most useful. You kind of feed off each other when you're practicing. Yeah, so it's just kind of, even if you think your experiences are small, if you're able to relate them to kind of the key competencies of teamwork, communication, stuff like that, it's really good to practice trying to bring all your experiences together, and just kind of how to verbally communicate them is really good as well. So that's why I'd say practice is key.
Anything to add, Aditi? Casting your mind back.
I totally agree with Sim. Definitely practice. I would literally practice on my brother, on my mum, and make sure that your examiner, so whoever you're doing it with, they can be nice. They can also be quite harsh, so that when you come to the interview day, you don't panic that, oh, okay, why is my examiner looking at his phone? Why is my examiner kind of, being rude to me? So make sure you're ready for every kind of scenario that could possibly come your way.
Yeah, but again, think about it nearer the time. I would say definitely it's good to kind of have an awareness of stuff, but try not to get so overwhelmed with all these different things that you're going to think about for quite a while. I'd say. Amazing. Thank you, guys. If you didn't get to reply to a question, we will be writing to you and sending you a response after the event. So don't worry, we'll keep those questions and respond to them. Amazing. We are almost done. Let me see. So at this point, just to flag again, as I've mentioned, some upcoming webinars we have. So I mentioned already our work experience for healthcare courses, which includes medicine at the end of March. If you haven't already signed up for it, we will send you a link if you want to sign up to that afterwards. The Exploring Healthcare Courses and Careers, that's focused on other healthcare courses and careers. It's quite an early stage. You might be thinking, well, I'm not sure I want to do medicine. I might want to do another healthcare course. So hopefully in that event, you'll find out a bit more about different pathways and what different professions do. And again, it's just about doing that kind of research and finding things out early stage to help you make informed choices later on. So if you're interested, do join us for that as well. That's nearly it from us. Just to say, if you do have any questions, then you can get in touch. If you have any questions about studying at St. George's, you can contact us via the email address there. Yeah, that's pretty much it. Massive thank you to you all for attending tonight and getting involved and interacting with it. It's been really nice, and we really hope you found this event useful. As I've said, we are recording it. We will send you that recording afterwards. We would really like to know kind of how you found the event. So afterwards, a survey will pop up, and that will also come in your post-event email. If you could let us know how you found today, that would be really helpful. It just helps us make improvements for the future. And I think that is pretty much it. If you do want to find out a bit more about St. George's, we do have current students that you can talk to on our website. So if you go on our website, you'll see some little faces pop up and it tells you about students. And that's a really great way to kind of speak to our students about their experiences at George's doing particular courses, to do kind of keep in touch and speak to students that way if you want a bit more insight. Amazing. But we hope you've found this event useful. Have a great night, and we hope to see you on another George's webinar soon. Take care, everyone. Have a good evening. Bye for now.